Going back to our objectives for today was really to generate dialogue, and those 3 questions were really the beginning of that dialogue, and I hope you'll join us in continuing on some of those brainstorming and those ideas. Has life sciences reached a plateau? It's very clear from today, absolutely not. However, but it has changed. The complexity has changed. And really what I heard a lot of today is creating the conditions for that innovation to thrive, not really questioning whether the innovation exists so much, but how do we capitalize it, leverage it with very new approaches, new models for moving forward. Everything, as Barbara just mentioned, nurturing the pipeline, but maybe nurturing the entire pipeline, not just sections to it. Does current investment risk return still work in life sciences? The answer is it's clearly changing. It is not what it was and previous times in our history. The complexity is changing. I think one thing that came out a few times today was the consumers are changing. The health systems themselves are changing, and that's what we're doing a lot of work on at the IB Center, is how do you drive innovation adoption? You can't simply drop new innovative technologies from life sciences in health systems, hope and pray that they're actually going to be adopted. Similarly with consumers, it's a very different consumer. Baby boomers all by themselves account for more than half of the retail spending in North America. And they want access, we heard about that today as well, and they want access like now on the terms that they're interested in it. We also heard a lot about how does the industry and how do you move forward for fostering innovation. There is no question if there was one dominant theme today, I think it's collaboration. And those collaborative models are very much a work in progress from the sounds of it, and it's very much about how do you create value. So collaboration at our center, we engage people in health innovation projects. We actually bring the clinicians together, put them on the same team as the researchers, the business community, the private sector, even the policymakers and regulators, although sometimes they're not really sure why they're there. But when you bring them together, you start to create a very different model, and you create a value to support innovation. And the value is not just about patients. It's proof of concept, of course, to achieve improved products, therapies, approaches for healthcare with patients, but it's also improved work life for clinicians. If there are better, faster, more productive way of doing things and technology allows clinicians to achieve that, then I think you've achieved a great deal for work life in general of clinicians and our ability to retain them in health systems. Value for health systems, of course, we hear a great deal about cost. There isn't a health system in the world that isn't struggling with managing costs and growing demands, where our next white paper, which is in the November conference, by the way, here in Toronto, is around the cost versus the value. We know a great deal about cost. We're not as well defined in terms of value and value for health systems. We tend to look at a particular therapy for a group of patients and perhaps a particular clinical setting. We do much less work along the entire continuum of care. If it means we can keep people home longer, greater quality of life, that also happens to reduce our ED admissions or other acute care costs, then we've achieved a value. The question is, how do you build the evidence for those new therapies, those innovative technologies to accomplish those very, very important things? I am thrilled, to say the least, with the suggestion that Canada really needs to position itself as that global laboratory for innovation. We're small. Although we have a very highly educated workforce, 80% of our tertiary care services are actually delivered in academic health sciences centers, unlike most other countries. So we have this phenomenal laboratory where you've already got the clinicians, the researchers, the students from a number of disciplines in the same place to conduct some of that laboratory work. Timeframes is clearly important. And I'll finish with really one of the things we're spending a lot of time on at our center, and that came up earlier as well, is you've got to create the evidence for the value of those innovations. The proof of concept is what we've relied on for decades in healthcare. If it makes patients' lives better, greater quality of life, then we should invest. But it's now no longer just about proof of concept. It's proof of relevance. So where is the relevance for what population in the health system and achieving what across the continuum of care? And then thirdly, which we also alluded to, I think, today, not only proof of concept, proof of relevance, proof of reimbursement. So how does it get reimbursed? And I think health systems are struggling just as much with those financial models, those collaborative partnerships that they're not long and strong on any more than any other sector within this life sciences environment. But looking across proof of concept, proof of relevance, proof of reimbursement, I think will be fundamental. In order to accomplish all those things, and I've said this more recently in a few presentations, the universities have a phenomenally important role to play. It's not just the technologies coming out of the research labs. It is how are we educating students, and I think Barbara spoke to this a moment ago very eloquently, to think differently. So putting the business students in the room with the physicians or the MD students, the nurses, the other health providers, along with the engineers and the computer scientists, suddenly they start to cross-reference each other's perspectives, because with the complexity growing in healthcare today, one will not be able to function and deliver their particular role in the health sector nearly as well as they need to be without that innovation and that collaborative environment across disciplines. So when I have a classroom of students and the business students say, well, it's no problem how to fix healthcare, just tell the physicians they have to do it. It's like we have a long way to go on educating business schools, just as in the health sector, just as we do our students in health professionals. So with that, I will close my remarks. Thank you all very much for an incredibly interactive and very dynamic dialogue that I think was phenomenally important in terms of moving this innovation agenda forward, not just in Canada, but globally. It is a global issue that I think all of us are very committed to. And thank you ever so much for joining us, to the speakers who came from all over the world. Thank you. It has really made this particular conference wildly successful, and we are ever so grateful for your continued support.